This is Dr. Kline, and we're going to show you how to give medications to a bunny today. We have Thumper here, who's been a very good patient today, and we're going to demonstrate first the technique for giving medications, which is called the bunny burrito, and then we're going to give those medications. I'll show you guys. It's a pretty easy technique to learn. So the way we start, I always have the bunny, usually like to have them on a table, their butt towards me and their head facing away, and I like to have a big old towel, one you don't mind getting bunny poop or pee on, by the way, that we're going to wrap him up in like a little burrito. So I always have a hand on his shoulder so he doesn't run away from me, and I'll take it and I'll kind of wrap it tightly over his shoulders on one side, and then take the other one, wrap it over here. Then once I have him kind of snug, I'll move him towards me, so I'll use my belly as the kind of the back wall so he can't back up on me. So now we can see we have a cute little bunny in a burrito, and he's not going anywhere. So I'm still holding on to his shoulders so he's not moving forwards or backwards, and I can kind of move his head around where I want to. So that's the technique. We have 3 medications. The first one we're going to do is Panicure. So this is the one we're going to use for E. caniculi. We're drawing up halfway to the syringe, so to the 0.5 mark, 1/2 of a milliliter. This one is given only once a day, so the first dose is now, the next dose is in 24 hours, around 8 p.m. tomorrow. What I do, I'm a righty, so I hold the syringe in my right hand between my middle finger and my thumb, and my index finger controls the plunger. With my left hand, my non-dominant hand, I am putting my thumb over the top of his head, my index finger underneath, and that way I can kind of move his head up and down and control it. I don't have to push too tight, and I'm not putting any pressure on his neck so he can breathe just fine. What we're going to do is I lift the head up a little bit, I put the syringe tip right by his little lip, we can lift it up, and I'm going to put it right behind his little tooth so we can see that it's in the mouth. A lot of times bunnies will start chewing once you're in there. As soon as you're in, push in, and he swallows for us just like a good boy. Second one is azithromycin. This is our antibiotic. Since he's running a fever and we think he's probably got a bacterial infection in his GI tract in addition to what's going on in his head and his ear, this is going to treat that. So this is about 1.4 milliliters. This is about 4 little ticks past the 1 mark. This is also once daily. We're going to do the same thing. Lift up his little lip into the teeth. Once he starts chewing, we'll put it in, and he swallows for us. Good boy. Last one is Medicam. So this is the only one that's 2 times a day. This one's kind of a tan. It has a very distinct smell. Rabbits tend to like this flavor the best, so I always save it for last. This one is 0.9 milliliters, or 90% of a milliliter. So it's almost a whole syringe. This one is twice daily. So the first one's tonight, the next one's tomorrow morning. This one's for pain and inflammation. Good job, buddy. Perfect. So once we're all done, we can unwrap him and kind of send him on his merry way. He can do whatever he wants at that point.